Welcome to my autobiography. My generic name is FLUTICASONE. My brand names are Flovent and Flonase, and my chemical name is this. My drug classifications, my therapeutic actions are anti-inflammatory, anti-asthmatic, anti-allergic, and decongestants. My pharmacologic classification is corticosteroid. My pregnancy category is in pregnancy category C. I should be used only if the potential benefit justifies the potential risk to the fetus.
Mechanism of action. I decrease inflammation by inhibiting mast cells, macrophages, and mediators such as leukotrienes. I bind and activate glucocorticoid receptor, resulting in the activation of lipocortin. Lipocortin in turn inhibits cytosolic phospholipase A2, which triggers a cascade of reactions involved in the synthesis of inflammatory mediators such as prostaglandins and leukotrienes. Mitogen-activated protein kinase phosphatase 1 is induced, thereby leads to the phosphorylation and inactivation of Jun N-terminal kinase, directly inhibiting c-Jun-mediated transcription. Finally, transcriptional activity of nuclear factor kappa B is blocked, thereby inhibits the transcription of cyclooxygenase 2, which is essential for prostaglandin production. Pharmacokinetics. For the topical route, my onset, peak, and duration are unknown. For my nasal route, my onset is 12 hours, peak is for several days, and my duration is for 1 to 2 weeks. For my oral route, my onset is 24 hours, peak is for several days, and the duration is 1 to 2 weeks. Indication. I am indicated for the relief of inflammation and pruritus from corticosteroid responsive dermatosis, management of nasal symptoms of seasonal and perennial allergic and non-allergic rhinitis, and for the maintenance treatment of asthma as prophylactic therapy. Contraindication. I am contraindicated in patients hypersensitive to my drug or my components, and in patients with viral, fungal, herpetic, or tubercular skin lesions. Flovent inhalation aerosol and powder are contraindicated as the primary treatment in status asthmaticus or other acute episodes of asthma where intensive measures are required. Use cautiously in breastfeeding women. Side and adverse effects. In the CNS, patient might experience headache, dizziness, fever, migraine, and nervousness. In the EENT, there might be pharyngitis, blood in nasal mucus, cataracts, conjunctivitis, dry eye, epistaxis, laryngitis, nasal discharge, rhinitis, and sinusitis. In the GI, patient might experience oral candidiasis, abdominal discomfort, abdominal pain, diarrhea, mouth irritation, nausea, and vomiting. In the GU, patients might acquire UTI, for metabolic hyperglycemia, weight gain, growth retardation in children, and Cushingoid features. For musculoskeletal, there might be pain in joints, sprained or strained eggs, and pain in limbs. In the respiratory, there might be upper respiratory tract infection, bronchospasm, asthma symptoms, bronchitis, chest congestion, and cough and dyspnea. Nursing responsibilities. Before administering me to your patient, you must first assess for possible contraindications and cautions, such as acute asthmatic attacks and allergy to the drugs, systemic infections, pregnancy, or lactation. Perform a physical examination to establish baseline data for assessing the effectiveness of the drug and the occurrence of any adverse effects associated with drug therapy. Assess temperature to monitor for possible infections. Monitor blood pressure, pulse, and auscultation to evaluate cardiovascular response. Assess respirations and adventitious sounds. Examine the nares to evaluate for any lesions that might lead to systemic absorption of the drug. During administration, do not administer inhaled steroids to treat an acute asthma attack because these drugs are not intended for treatment of acute attacks and will not provide the immediate relief needed. Taper systemic steroids carefully during the transfer to inhaled steroids. Have the patient use the congestant drops before using the inhaled steroid to facilitate penetration of the drug if nasal congestion is a problem. Have the patient rinse the mouth after using the inhaler because this will help to decrease systemic absorption and decrease GI upset and nausea. Monitor for signs of infection. Educate the client regarding the drug and its adverse effects. Ensure effectiveness of the drug and provide support. After administration, monitor patient response to the drug. Monitor for adverse effects like nasal irritation, fever, and GI upset. Evaluate the effectiveness of the teaching plan, like if the patient can name the drug, dosage, adverse effects to watch for, specific measures to avoid them, and measures to take to increase the effectiveness of the drug. And lastly is to monitor the effectiveness of other measures to ease breathing. And that would be all for my autobiography. I hope you learned something about it. Thank you for watching.